The next tier could be eligible as early as March 22nd. It includes critical workers who operate in congregate settings, meaning they have to interact with large numbers of people every day. That could be anyone from grocery store employees to firefighters to bus drivers. Right now, we don't have a complete list. The governor's office said the Department of Health is working on one. That tier will also include pregnant people and people with high-risk disabilities. What exactly counts for those disabilities also hasn't been identified yet. A few weeks after that, people 50 years or older with at least 2 comorbidities will become eligible. There's a list of qualifying conditions on the CDC website. And 2 weeks after that, people 16 plus with comorbidities will also be allowed to get the shot. So too will people who live in congregate settings like homeless shelters. The governor said this timeline was made possible because of the federal push to distribute doses faster and that new Johnson & Johnson vaccine.
I have to tell you, I am thrilled at the progress that our federal government is making in combination with these manufacturers to increase supplies.
But if supplies don't increase, this timeline could be pushed out.
Now again, these dates, of course, have to be tentative, and expanding eligibility will depend on supply and our progress in vaccinating earlier groups.
Regardless, finally having real hope of getting vaccinated is a big deal for local grocery store workers.
It's awesome. I've been waiting to get my vaccination for a while.
It's been nearly a full year that such employees have been going into work interacting with thousands of people a week.
It will definitely be a load off my mind. That's always in the back of your mind. We tried to follow a lot of protocols to keep ourselves safe, but you never know.
Through all the ups and downs of the pandemic, and as other groups of people were prioritized for the shot, folks like these kept on working.
I will tell you, I am very happy that we as an industry are going to be protected. We see a lot, and not all of the other groups do.
So today's news was long awaited. But the state health secretary also cautioned even when these groups do become eligible, they may have to wait a little longer yet before they actually get the shot.
You may not be able to get your appointment immediately, so we do want you to exercise some patience as we continue to move forward.
Casey Decker, KREM 2 News.